New videos every day.
Life, wisdom, Psychetruth, massage.
Thank you for tuning in to another video. My name is Meera Hoffman, and today I'm working with Kartina. We're going to be opening up her shoulders a little bit more, and I'm working down into the forearms and arms and hands. So a lot of these techniques are great, as I talked before, for headaches and migraines or neck tension or shoulder pain. And then as we work further down into the arm and forearm, you're going to see a lot of benefits for people that maybe have little arthritis or joint pain or carpal tunnel syndrome. That's a lot of concerns that I think many folks experience as they get later in life or have any repetitive motion injuries. So if you're at the computer or a desk a lot, typing a bunch, it's not ergonomically the best for your hands, and you'll probably feel those effects over time. So some of the techniques that we'll be going over today are great for those. So I'm going to start off with working a little bit into Kartina's shoulder, and I'm going to use a nice broad firm pressure here by placing my forearm at the top of her shoulder in the most meaty part. And then I'm actually going to do some assisted movements. So I'm going to pick up Kartina's arm, and she's going to just stay nice and heavy here. So you can see she's just completely giving all of her weight to me. And as I do that, I'm just going to kind of rotate it down and open up the shoulder a little bit. You can even push down on the shoulder blade a little bit more and reposition my arm to melt into another part in the shoulder. And Kartina, go ahead and take a nice deep breath here. And so as she breathes, she's using the breath to help relax, but she's also pushing into my arm. And so it's kind of giving a counter pressure from my forearm. So we're getting kind of both sides worked. You can also turn around and come from the back side. And then with this one, I kind of like to give just a little bit of length here. And I'm going to grab at the crux of her elbow and really just open up the top of the shoulder, giving a little bit of movement here to help facilitate the top of her shoulder opening as I kind of glide on top of those muscles. And then we can also do some nice stretches. So one of the stretches that I really like is bringing the shoulder up and out, and you can see I'm supporting both at her elbow and wrist. So you don't want to have all the pressure down here, because sometimes people have a little tension in their elbow, or it makes them want to kind of hold or pick up the weight. You don't want them fighting you as you do that. And we can kind of rotate back down and come up again. You can see this really opens up the back of her shoulder blades, really stretching the rhomboids out. And then as we loop down, we're really getting a nice opening in the neck here. And sometimes I'll even just take my hands and kind of give a positional placement to lengthen that area. And some of these stretches can be a little intense, so it's always good when you're doing that, just make sure the range of motion feels comfortable to your partner. And then I'm just kind of gently kneading the tops of the shoulders, kind of working out what we've just done. And then again, kneading all the way down, compressing and squeezing out the fingertips. And I'm going to bring her arm back down here so she feels supported and she doesn't feel like she needs to help me. So I'm going to work a little bit more in detail in Kartina's forearm and arm and hands. I'm actually going to sit down on a little stool. And for this, I like to use a little bit of lotion. Typically, chair massage doesn't use lotion, but for the hands and forearms, I find that it helps kind of just give a little bit more movement. It makes it easier to work a little bit deeper into those areas. So just some nice long strokes to apply that lotion. And then I'm going to start by opening up her hands. So kind of almost just squeezing and opening the back side. If you want, you can take some nice circles right at the base of the wrist. And then I like to kind of walk those up between the bones. So you have the radius and ulna bones in your arm, and there's some nice musculature in between those bones, and then all the way up into the elbow. And then this muscle on top actually connects into your humerus, so further up. So this nice long stroke. You can also use the palm of your hand to do some gentle stroking here. And these techniques are great. Kartina doesn't need to even be in a massage chair to receive this. She could just be sitting, hanging out on the couch, or if you're together at the dinner table and your arms or forearms are maybe bothering you after a long day at work, maybe your partner can help you out and work on those. So then coming back down into the fingers. And to really open up the hand, there's a couple things that you can do. So one of those things is I'm going to spread my hand and I'm going to place my pinky between her middle finger and forefinger. Then I have my two fingers between the forefinger and thumb, and then lastly my pointer finger on the outside of the thumb. So we place the my pinky finger between Katrina's middle finger and ring finger. I have my middle finger and ring finger between her pointer and thumb, and then my pointer on the outside of her thumb. And it's a little complicated at first, but it'll make sense in a second. And then I'm going to do the opposite thing to the outside of her hand. I'm going to place my pinky between her middle finger and ring finger, and then my ring finger between her ring finger and pinky. Basically what you're trying to do is just fold the palm open and get access to that. So if that seems too complicated to you, feel free to modify it just to kind of open up the hand. So what I'm doing is, as I do that, I can really fold open her hand, and this really exposes and brings to the surface all those muscles and starts to stretch them out. So the palm side of the hand, I'm just doing some nice strokes starting from the center and then pressing outwards. This feels nice and relaxing. And when you get up to the knuckles and kind of balls of the hand, you can make little circles. And switching thumbs. And then when you've worked this area pretty thoroughly, for as long as feels good to you, you can release the hands and then just bring the thumbs and just kind of knead the outside of that thumb muscle, both sides. Feels really nice. And I'm going to rotate her hand with palm face down, and then I'm just going to pull out the fingers. And it's just a nice kind of finishing stroke to say goodbye to the hand. And the way I do is I kind of start at the base as much as possible and pull out between the bones and the fingers, and then out and around each finger joint. And again for this one. Sometimes you'll kind of come off the middle or webbing of the fingers, and that's okay. And just pick up the finger and pull out the finger as well. And this one. So with carpal tunnel syndrome, a lot of times there's a combination of muscle tension and postural deviations that have developed over time from repetitive motion. I'm sitting at a keyboard and typing. Maybe sometimes you're doing some intricate work with your hands. And so it's always great to get regular massage to help combat that repetitive motion stress. Because over time, what you'll notice is the tendons, which are more of a fixed thing, will start to shorten, and you'll get a compression around that medial carpal nerve, and that's what causes the pain. So a lot of doctors recommend that you get surgery because of that, and that is one option to help deal with the pain, but I would recommend trying some natural options first before you take that as your ultimate solution, because that's not reversible. Once you get that surgery, that's it. And then you're also dealing with surgery, post-surgery recovery. Sometimes one surgery isn't enough to alleviate all the symptoms that you're feeling. So I feel like that's a pretty drastic choice to make, that I would use it as a last resort and kind of explore some other options before you do that. So right now I'm kind of just flushing the blood using a nice broad stroke back towards Katrina's heart and torso, and coming outside the elbow. I can also pin the muscles between the radius and ulna and just do a slight rotation in her wrist. And I'm just kind of working back towards the heart, opening up that area. And all this is going to feel really amazing if you use your hands a lot. Kind of feeling some tension here, some little adhesions. So each muscle is covered and coated in fascia, and that's what helps hold the muscle in place. It's a good thing. But sometimes when you overuse the muscles or have them held in a way that's maybe not the best postural alignment for them, they'll start to develop this splinting of the fascia. So the fascia is going to start and reach out to surrounding muscles to help kind of support it and take the tension and load off that muscle. And when that happens, that's when you start to feel those knots and those areas of tension because the muscle's not able to glide smoothly as it should. You get kind of in that locked position. And that's when manual massage is really great because it'll help release those areas and work that fascia back into a more functional arrangement. So just kind of giving some nice broad pressure and compression back towards the heart and just flushing out that area and returning the blood. You can also place the thumb in between the radius and ulna and melt into those muscles between the bones. And I'm doing a little bit of rotation with Kartina's wrist. It's kind of rocking from side to side to get that area to open up. Again, we talked about how we can make movements a little bit more dynamic and get them to the muscles to release a little bit more easily. And then as I work, kind of coming all the way up into the elbow. And we're going to give the bicep a little bit of kneading and petrissage. And we can also knead the outside, the triceps. A little squeeze, and then coming out into the deltoids and back into the shoulder. And so at this point, we would switch and do the other side. So you can just replay the video if you're interested in seeing all the techniques that we did before. And if you want to find out more about chair massage and my business, my website is austinchairmassage.com. But please leave me a comment below or a question. I'd love to know what your thoughts are in this video. If you have any tips that you found that are great that you want to share with the community, we welcome those as well. And subscribe to the Psychetruth channel. There's thousands of videos on nutrition and health, wellness, and massage to help empower you to take control of your health and lifestyle. Thank you for joining us today.